Introduction. Are you concerned about your cholesterol levels? Maintaining healthy cholesterol levels is crucial for overall health. High cholesterol can lead to various health issues, particularly impacting heart health. In this video, we will explore ways to lower cholesterol the healthy way. It's important to understand that cholesterol plays a significant role in our bodies. There are two types of cholesterol: LDL, bad, and HDL, good. While HDL helps remove LDL from the bloodstream, high levels of LDL can increase the risk of heart disease. Lowering cholesterol through diet and lifestyle changes is key. By incorporating healthier eating habits and adopting an active lifestyle, you can effectively manage your cholesterol levels. Let's delve into the details of understanding and tackling high cholesterol for optimal health. Understanding cholesterol. Cholesterol is a type of fat that is naturally produced by our bodies and also found in certain foods. It plays a crucial role in various bodily functions, including hormone production and cell membrane formation. However, having high levels of cholesterol, especially low-density lipoprotein, LDL, or bad cholesterol, can significantly increase the risk of heart disease. LDL cholesterol carries cholesterol to different parts of the body where it is needed. But when there's an excess amount of LDL in the bloodstream, it can start to build up on the walls of arteries, forming plaque. This leads to a condition known as atherosclerosis, which narrows and hardens the arteries over time. On the other hand, high-density lipoprotein, HDL, or good cholesterol helps remove excess LDL from the bloodstream and transports it back to the liver for excretion. HDL acts as a protective factor against heart disease by reducing LDL levels. Understanding these differences between LDL and HDL is essential because they have opposite effects on cardiovascular health. To maintain healthy cholesterol levels, we need to focus on lowering LDL while increasing HDL. When our blood contains too much LDL cholesterol due to factors like poor diet or genetics, it increases our risk of developing conditions like coronary artery disease or suffering from heart attacks and strokes. That's why monitoring and managing our cholesterol levels becomes crucial for maintaining overall health. In order to effectively lower your bad LDL cholesterol levels through lifestyle changes alone, you will have to adjust your diet towards healthier choices including vegetables, fruits, whole grains, lean meats, poultry, fish, nuts, low-fat dairy products, olive oil, avocados, beans, legumes, seeds, nuts. Additionally, regular exercise, not smoking, avoiding trans fats, limiting alcohol consumption, maintaining healthy weight are all key components contributing positively towards improving one's lipid profile. The role of diet. Maintaining a healthy diet plays a crucial role in lowering cholesterol levels. Understanding which foods contribute to high cholesterol is essential for making informed choices about what we consume. Foods that are high in saturated and trans fats have been linked to increased levels of LDL, low-density lipoprotein, cholesterol. These include fried foods, processed snacks, fatty meats, and full-fat dairy products. By limiting our intake of these foods, we can significantly reduce the risk of elevated cholesterol levels. To lower cholesterol the healthy way, it is recommended to incorporate more heart-healthy foods into your diet such as fruits, vegetables, whole grains, and lean proteins should become staples in your meals. These nutrient-rich choices provide essential vitamins, minerals while being low in saturated fat. Additionally, focusing on consuming foods rich in soluble fiber and omega-3 fatty acids can further promote healthy cholesterol levels. Soluble fiber acts like a sponge in the digestive system by binding with dietary cholesterol, preventing its absorption into the bloodstream. Excellent sources of soluble fiber include oats, beans, lentils, fruits like apples, oranges, and vegetables like Brussels sprouts. Furthermore, omega-3 fatty acids have been shown to reduce triglyceride levels, another type of blood fat that contributes to cardiovascular disease risk. Oily fish such as salmon, tuna, and mackerel are excellent sources of omega-3s. Additionally, walnuts, chia seeds, and flax seeds also contain this beneficial fat. In conclusion, the role of diet should not be underestimated when striving for healthy cholesterol levels. Eliminating or reducing high-saturated fat foods whilst incorporating more heart-friendly options, such as fruits, vegetables, whole grains, and lean proteins, alongside actively seeking out soluble fiber-rich foods and omega-1 fatty acid sources will contribute to lowering cholesterol levels in a healthy way. By making these dietary changes, you can take control of your cholesterol levels and improve your overall heart health. Lifestyle changes. Making certain lifestyle changes can greatly contribute to lowering cholesterol levels and improving overall cardiovascular health. By incorporating these changes into your daily routine, you can take significant steps towards managing your cholesterol. Regular physical activity plays a crucial role in cholesterol management. Engaging in exercise not only helps lower LDL, bad cholesterol, but also increases the levels of HDL, good cholesterol in the body. Aim for at least 150 minutes of moderate intensity exercise per week, such as brisk walking, swimming, or cycling. Exercise promotes better blood flow and strengthens the heart muscle, reducing the risk of heart disease. Maintaining a healthy weight is equally important when it comes to controlling cholesterol levels. Excess weight can lead to elevated LDL cholesterol and triglyceride levels while lowering HDL cholesterol. By adopting a well-balanced diet and engaging in regular exercise, you can achieve and maintain a healthy weight range that supports optimal heart health. It's essential to develop healthy habits that promote overall well-being and help lower cholesterol. One significant habit to address is smoking cessation. Smoking damages blood vessels and reduces HDL cholesterol, making it harder for your body to remove LDL from your bloodstream. Quitting smoking not only benefits your cardiovascular health but also improves lung function and reduces the risk of various diseases. In conclusion, by incorporating lifestyle changes such as regular physical activity, maintaining a healthy weight, and quitting smoking into your routine, you can effectively manage your cholesterol levels. Remember that small yet sustainable modifications are key to long-term success in maintaining optimal cardiovascular health. Medical interventions. For some individuals, lifestyle changes alone may not be enough to achieve optimal results in lowering cholesterol levels. In such cases, medical interventions can play a crucial role. Prescription medications are commonly used as an adjunct to dietary and lifestyle modifications. These medications work by targeting different aspects of cholesterol metabolism and reducing the production or absorption of cholesterol in the body. Some common types of cholesterol-lowering medications include statins, bile acid sequestrants, fibrates, niacin, and PCSK9 inhibitors. Statins inhibit an enzyme involved in cholesterol synthesis and have been shown to effectively lower LDL, bad cholesterol levels while reducing the risk of cardiovascular events. Bile acid sequestrants bind to bile acids in the intestine, preventing their reabsorption and promoting their excretion from the body. This leads to increased clearance of LDL cholesterol from the bloodstream. Fibrates primarily target triglyceride levels but also have modest effects on increasing HDL, good cholesterol levels while decreasing LDL cholesterol levels. Niacin helps raise HDL cholesterol while simultaneously lowering LDL and triglycerides when taken at higher doses under medical supervision. PCSK9 inhibitors are relatively newer additions to lipid-lowering therapies. These monoclonal antibodies target a protein called PCSK9 which plays a key role in regulating LDL receptor function. By inhibiting PCSK9, these medications increase the number of available receptors on liver cells for removing LDL from circulation. It is important to note that these medications should always be prescribed and monitored by healthcare professionals who will assess individual risks, benefits, potential side effects, drug interactions, overall suitability based on each person's unique health profile. Medical interventions for lowering cholesterol should be seen as complementary to lifestyle changes and not a replacement for them. Adopting healthy habits, such as consuming a nutritious diet, engaging in regular physical activity, maintaining a healthy weight, and avoiding smoking should always be the foundation of cholesterol management. In conclusion, while lifestyle modifications are crucial for managing cholesterol levels, medical interventions can provide an additional boost in achieving optimal results. By working closely with healthcare professionals and following personalized treatment plans, individuals can take control of their cholesterol levels and reduce their risk of cardiovascular disease. Remember that every person's journey is unique, so it's important to consult with your doctor to determine the best approach for you. Conclusion: maintaining healthy cholesterol levels is crucial for overall health and well-being. Throughout this video we have discussed various strategies to lower cholesterol levels the healthy way. Firstly, it is important to understand what cholesterol is and its role in the body. We have highlighted the difference between LDL, bad cholesterol, and HDL, good cholesterol, emphasizing the risks of high cholesterol levels on heart health. Secondly, adopting a healthy diet plays a significant role in lowering cholesterol. By reducing intake of foods high in saturated fats, trans fats such as processed snacks, fried foods, and incorporating more fruits, vegetables, whole grains, lean proteins into our diet can help promote healthier cholesterol levels. Additionally, consuming foods rich in soluble fiber, omega-3 fatty acids, has been shown to be beneficial for managing cholesterol. Furthermore, making lifestyle changes like engaging in regular physical activity is essential for cholesterol management. Exercise helps raise HDL, good cholesterol, while decreasing LDL, bad cholesterol levels. It also promotes weight management, which is crucial for controlling your cholesterol effectively. In addition, quitting smoking plays a vital role by raising HDL, good cholesterol, whilst decreasing LDL, bad cholesterol. Smoking cessation resources are available which can provide guidance on quitting smoking successfully. While lifestyle changes play a vital role in lowering cholesterol naturally, it's important to recognize that medical interventions may be necessary for some individuals who struggle with extremely high or resistant forms of hyperlipidemia. Prescription medications prescribed by healthcare professionals might be required alongside lifestyle modifications. This ensures comprehensive management catered towards individual needs. Always consult your doctor before starting any medication regimen or making drastic changes to your lifestyle. To wrap up, by following the tips and strategies mentioned above, individuals can take control of their cholesterol levels and improve their overall health. It's essential to make small, sustainable changes that can be maintained in the long run. Remember, maintaining healthy cholesterol levels is a lifelong commitment that should not be taken lightly. By implementing these recommendations into your daily life, you are taking proactive steps towards a healthier heart and better quality of life for years to come. Stay committed to making positive changes and consult with healthcare professionals who can guide you on this journey towards optimal cholesterol management.